So now, with the COVID-19 pandemic comes another challenge, information overload. There is a lot of information out there about the management of COVID-19, the risks, impact, and many of them are unverified, adding to the already bad situation. Now that the vaccine is due to arrive in Nigeria, there are already misconceptions, conspiracy theories, and doubt in some quarters. Joining me via Skype from the United Kingdom is the second Vice Chairman, Association of Public Health Physicians of Nigeria, Lagos chapter, Dr. Alero Roberts. Good morning. Thank you for joining us on TVC Breakfast.
Good morning, and thank you for having me.
All right, talk to us or help us better understand how the infodemic, inaccurate information, poses a challenge while dealing with the pandemic.
Oh my word, how long do we have for this program? The single biggest problem we have faced is this infodemic of misinformation and misinterpretation of knowledge. Now, it's not that because people deliberately want to hear or believe the wrong thing, but what has become very evident is the dearth of foundational knowledge people have about disease causation, disease transmission, disease prevention, management and treatment. So, we're working literally in the face of decades of poor education and trying to suddenly ramp up and give people an education that requires, generations of establishment. So it's very difficult. I mean, some of the things I've heard even from supposedly well-educated people has absolutely got me dumbfounded. Now, one of the misinformation messages that I think is going around is this issue of stay home when you're sick. Now, the meaning of that was that if you were feeling unwell, do not go into public so that you are not in danger of spreading the virus to other people. But what people seem to have heard is that even if I'm sick and I'm on death's door, I must stay at home, right. Which means that I must therefore, resort to whatever other means of health care provision that I can get. And so you've got people staying at home, treating malaria, treating typhoid, and not presenting themselves to the proper facilities. And that's another thing. There's been a dearth of the proper facilities that people could present to. Because if they presented to where they were used to going, and then they were told, oh, we're closed down, or we can't deal with COVID, or please go to this or other government place, people not used to going there would not go, because they don't even know when they get there, what are the protocols, who do they ask for, where do they go? It's all completely confusing. So we also have a responsibility to make the messaging very clear, to keep repeating the same thing over and over again. Lagos State has done a fantastic job. Where I stay, I see the adverts and things everywhere, showing pictorials of what the symptoms are and then a number to call.
Right.
A lot of people have done that, but we really need to clarify the messaging where it comes to this treat malaria, or I've been treating malaria for 2 weeks, and then the patient gets into hospital.
And that is the aspect I'd like for you to expatiate on, clarifying the message. How can we do it better?
That's a very good question. It's not for me to sit down here and say what it is. We need to sit down with the health information people and the media and the health communicators. There are health communicators and health promoters in our health system that have who have the skills and the knowledge of the people, because it's not a one-size-fits-all.
Right.
And this is where we were now taking the message down to the grassroots and bringing the community voices to the dialogue table, because what people would understand in one area is not the same thing that people would understand in another area. But the health promoters, health communicators in those communities are in a position to assist with clarifying this message. Does the message go out as a poster? Does it go out as a radio jingle? Do you put an advert up? Do you send the town crier? Do you call a town hall meeting? How do you clarify this message? Differs from community to community. Hence, you must have community involvement from the get-go.
Now, another aspect is how we intend to, beyond involving community communicators, as you have said, how else can perhaps we bridge the gaps that a lot of persons have said that there are gaps in the communication process, not just at the community level, because if you look at events that have taken place where some event centers were closed, the people at the community level are not the ones at those events. So how do we begin to reach out, bridge the gaps between these people who are seemingly not at the community level, but need to understand this message that their activities also pose a danger to someone or everyone around them?
I beg to differ, my darling. They are at the community level. Communities differ.
Right.
A community in Banana Island is a community. Whether it's in Banana Island or in Jorabadia, it is a community. And this is what I'm saying, that the message differs. You cannot use the message you give to the Banana Island community and go and give the same message to the Jorabadia community. So if we leave out the community characteristics, then we miss the message. Now, there was a very good intent, I am sure. By the time it came to end of November, early December, people were COVID weary. You know, and people wanted to party. We are social people. We are Nigerians. Parties are our thing, particularly in Lagos. You know, parties are our thing. You know, weddings needed to be celebrated, birthdays, etc., etc. Unfortunately, people felt that the COVID protocols were simply to assuage government regulations. So they said no mask, no entry. So they wear a mask. They enter. As soon as they cross the portal of the door, the mask comes down to the chin or starts hanging from one ear like a new earring. Then you say no crowds. You set a specific number. So they tell you that, oh yes, the number you set, no more than 300 people. We only sent out 150 invitations. You get to the event, there are 450, 500 people there. Masks down, trying to talk over loud music. So they're in each other's faces, talking loud, spitting out the virus. That's a community that you need to tailor a message to, separate from the community of, say, Jorabadia or Ejigbo or Surulere or wherever. So these were the things. Now you've got a situation where they say only the young people. I saw so many pictures of beach parties and young people at nightclubs having fun. Great. But they are going home to vulnerable people, or they are going to visit vulnerable people. You know, your son, your daughter arrived from the UK, the US. The next thing you're going to say is, don't forget to greet Auntie Lagbajao. Have you gone to see Uncle Tamodu? That's the message. They've come from the beach party, the club, the whatever, loaded with the virus. They themselves may be not exhibiting any symptoms. They're going to see the old folk. Then we start hearing the stories. So we have to tailor the messages. All communities are communities with peculiar characteristics. Right. Identify the community, identify the characteristics, tailor the message with those who know how to do it, now, including you, the media.
Right. Now, do you think that it is said actions speak louder than words? Do you think that the government in itself has ensured that their action help with the communication that they are putting across to the people? Because there has been complaints as well that perhaps the government is not showing that leadership that would make a lot of persons believe the message of observing the social distance and every other protocol that they are speaking about.
My sweet darling, I'm still a government employee.
Right.
Can we have the next question, please?
Right.
I think that says it all.
Okay, now, it's just that a lot of persons would have wanted to hear your perspective.
Well, the truth of the matter is we are the government that we have put in place. And, you know, government is as government does. That is just it. You can't blame government for you going to a party, getting infected, bringing it home to your mom and dad. They get sick, can't get care, can't get oxygen, and die. You cannot blame government for that, no matter who in government did the wrong thing. I'm sorry. We have a personal, collective responsibility. The virus hasn't got legs and arms. Like a phone, it is only mobile because we carry it. Right. So if I don't go to the party, if you invite me and I say, oh, I'm very sorry, my dad's in my house, my mom's coming over next week, I will not be coming to your party. Please don't be annoyed. Let's get this virus over. That is me taking personal responsibility for my folk. I'm not going to copy Senator X or House Representative Y to do what. He may not have parents in his house. She may not have anybody that she's looking after.
Quickly, before we let you go, if we are to address this, where do we begin the fight?
We begin the fight in the communities. Each and every one of us goes back to our families, to our communities, and starts. We can be the change that we want to be. We are the change agents. We're not going to wait for government. We don't wait for government to come and cook our food. We don't have to wait for government to know. Those of us that know the right thing to do need to start putting out the message in a way that your family, your community will understand. A lot of people that were supposed to be at that event where professors were getting infected and died, a lot of people chose not to go. Many more people chose not to go than went. Thank God.
All right, and that's a fine place to leave it now. Dr. Alero Roberts, Vice Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter, thank you for your time.
Thank you for having me.
You're welcome.